For millions of people who are dealing with nagging back, neck, and spine pain, chiropractic care feels like a lifesaver. And look, when it's done right, it can absolutely improve your mobility and just your overall quality of life. But today, we're going to look at the other side of that story.
Okay, so let's just dive right into this, because it's a question that probably doesn't cross a lot of people's minds. We put our trust in healthcare providers to help us, right? But it's so important to understand that there can be risks. So what happens when that care isn't up to par and someone gets hurt? Well, that's exactly what we're going to explore. So first things first, before we can get into the details, we really need to have a clear understanding of the main concept here. Let's break down what the term chiropractic malpractice actually means.
At its core, it's pretty straightforward. Malpractice is what happens when the care someone receives falls below the professional standard and, this is the key part, it directly causes an injury or makes things worse. Here's the thing to remember. Chiropractors are licensed healthcare providers. Just like medical doctors, they have a legal duty to provide a certain standard of care to keep their patients safe.
So what does substandard care actually look like in the real world? Well, it could be something like a chiropractor performing an adjustment without doing a proper evaluation first. Or maybe they're just ignoring a patient's complaints or using way too much force. It also includes failing to spot conditions that would make an adjustment dangerous. And this next one is a huge one, not referring a patient to a medical doctor when their problem is outside the scope of chiropractic care.
All right, so we've defined malpractice, but what are the real-world consequences? I mean, sure, a little bit of soreness after an adjustment can be totally normal, but what we're about to get into are injuries that are way more severe, and in some cases, completely life-altering.
This is probably the single most frightening risk we're going to talk about. A high-velocity neck adjustment, if it's done the wrong way or on the wrong patient, can actually tear the lining of an artery that supplies blood to the brain. This injury can trigger a massive, life-threatening stroke. And what's really sobering is that this isn't something that only happens to older people. It can affect younger patients too.
And it doesn't stop at strokes. An improper adjustment can cause direct damage to the spinal cord, which could lead to paralysis. It can also cause permanent nerve damage, herniated discs, or make a condition someone already had much, much worse. And let's be really clear here. These often aren't just freak accidents. They can be completely avoidable outcomes when the proper care is taken.
So who really needs to be careful? Well, we're talking about older folks with conditions like osteoporosis, anyone who's recovering from a recent trauma like a car crash, and people who already have vascular problems. This is exactly why a good, responsible chiropractor has to take a detailed medical history and do a physical exam before they even think about starting treatment. It's not a suggestion, it's an absolute must for safe care.
Okay, we've talked about what can happen and who's most at risk. Now let's get practical. How can you, as a patient, spot the warning signs of potentially bad care? This next part is all about arming you with the knowledge to protect yourself.
This chart really lays it all out, side by side. Over on the left, you've got the green flags, the standard of care. That's a provider who listens, asks questions, and explains the risks. But on the right, those are the red flags. A chiropractor telling you not to see a medical doctor, that is a huge warning sign. Same goes for pressuring you into a treatment plan or brushing off your symptoms. And listen, if you ever feel dizzy or start slurring your speech after neck work, that is not something to ignore. That's a medical emergency.
Knowing the red flags is step one, for sure. But what if you're worried the worst has already happened? This last section is all about empowerment. It's about helping you understand your rights as a patient and the exact steps you can take if you think you've been hurt.
Now, the legal stuff can seem really intimidating, but proving a malpractice case usually comes down to connecting 4 dots. First, you have to show there was a duty of care, that the chiropractor was responsible for treating you safely. Second, that this duty was breached, they didn't meet the standard. Third, you have to prove causation, that their failure is what actually caused your injury. And finally, you have to show damages, meaning you suffered real harm, like medical bills or lost wages.
So if you think you've been injured, what do? Here's your game plan. Number 1, and this is non-negotiable, get medical attention right away. Go to a doctor or an emergency room. Your health is the absolute top priority. After that, you'll want to request your complete file from the chiropractor, start documenting everything, your symptoms, your appointments, and then talk to a lawyer who specializes in this stuff to figure out where your options are.
And this quote, it really says it all, doesn't it? It perfectly sums up how serious this is. Chiropractic care is not without risk. And when negligence occurs, the consequences can be life-changing. It's a powerful reminder of why these professional standards matter so much.
So we'll leave you with this one last thought. Even though we focused on chiropractic care today, this lesson really applies to any kind of medical treatment. Think about it. For any procedure you or someone you love is getting, do you really know the potential risks? And do you know what your rights are as a patient? It's a question we should all be asking so we can be our own best advocates.